CHRISTUS Health is a faith-based Catholic health system located in Texas, Louisiana, and New Mexico here in the U.S. And we also have operations in Mexico, Chile, and Colombia. CHRISTUS Health has 35,000 employees, and they work in Infor on a day-to-day basis using workforce management, global human resources, the financials, and supply chain modules across Infor. CHRISTUS has to go through a regular audit process, reviewing inappropriate access, sensitive access, managing the provisioning and making sure that we're provisioning users with the right roles and responsibilities. We have a lot of risk in the organization for fraud, for duplicate payments, for access to sensitive data that we have to manage across the organization. We didn't have the tools in place to manage that initially, so it was important for us to address those quickly. So we partner with Infor and New River Systems to implement Infor's governance, risk, and compliance. And there's a set of rules that you implement across the modules. We were able to work through that list real quickly and identify what would be the most benefit to CHRISTUS Health. Now that we use Infor's governance, risk, and compliance here at CHRISTUS, we've really automated the management of that access and saving thousands of hours for our associates.
I'm most proud of the GRC solution in terms of how quickly we were able to implement each solution, from authorization insight, certification manager, and now access manager. And in the future, I see that transaction monitoring will probably be implemented just as quickly. When the auditors let us know that we had over 9,000 segregation of duties violations, it was a surprise. I knew there had to be a better way, because there's no way that we had over 9,000 segregation of duties violations, although the manual reports did speak to that. And we felt that if we implemented the GRC tool set, that we would be able to get a true violation output. And sure enough, we were. We went from 9,000 plus segregation of duty violations to actual 121 violations. And our GRC system administrator is able to provide those reports to external audit, internal audit in a swift manner. Because GRC authorization insight provides real-time segregation of duty risk violations, CHRISTUS Health is able to actually take immediate action towards mitigating those violations. We had a manual elevated access request process, which created a huge risk for CHRISTUS Health. The business or role owners were not communicating with the Infor approvers, and Access Manager was able to bridge that gap. Access Manager creates notifications that we've leveraged to actually send to the role owner, and another notification will send to the Infor approver. When these notifications go out, these two parties are able to now communicate and discuss if the elevated access is actually required for that user's job. One of the main benefits of Access Manager is that it has reduced our turnaround time for provisioning elevated access. Where it was 4 to 5 days, that has been reduced to 1 day. Prior to implementing Infor GRC Certification Manager, we were having issues auditing excessive access and access to sensitive data. There were just not a tool in place. Our GRC administrator runs a report within Certification Manager and then takes that report and identifies who actually has access to excessive roles or sensitive data. From there, our GRC administrator will then communicate with the business owners and role owners to review the reports and then identify who needs access removed. Our GRC administrator now has a one-stop shop where she's able to run audits for segregation of duty violations, excessive and sensitive data violations, and also elevated access requests.
We really wanted to streamline the operations and management of access. We're reducing our costs across the organization, allowing us to deploy those resources in other places and saving us a good bit of time and money in the organization.